Hi, today I want to talk about common causes of back pain, when to seek help, what sort of investigations you might need, and some basic methods or things that you can do to help treat that. I think the first thing we should do is have a look at the spine, see what it's made of, and why we get back pain. Well, firstly, your spine is made up of a stack of bones called vertebrae, and these start off deep in the pelvis and around your waist and make their way up all the way to the skull. Now, bones stacked together and separated by these little cushions here called discs. Each bone is then attached to an arch of bone at the back, and together that creates a sort of tunnel down the middle which contains your spinal cord. That's contained in your neck and the thoracic region, the midsection of your chest, and then lower down all the spinal nerves. And at each level in your spine, a nerve leaves the spine. This whole unit is what is the core of your skeleton, essentially. It's where your arm bones, shoulder bones, pelvic bones are attached to. And there's a big group of muscles that support and surround this unit, and that we broadly refer to as the core. That includes your abdominal muscles at the front of your tummy, and then you've got hip flexors that are attached to the spine, and at the back of the spine there are paraspinal muscles which help hold the back upright. The spine itself is all strapped together. All these bones are strapped together by various ligaments, which are little straps of tissue that hold it together. And at the back of the spine, you have facet joints here that hold each segment together. And a problem with any one of these things, the muscles, the joints, the discs, the nerves, and the joints, all of these things can contribute your back pain, or can be the target of treatment for back pain. Often it's a combination of these things, but actually most of the time it's coming from the muscle itself. If the pain is just concentrated in the lower back, it's fairly recent, and you don't have any pain shooting down your legs or any numbness or weakness in the legs, then there isn't really any need to dive in and pay for expensive scans or anything like that just yet. It likely is to be muscular or secondary to some wear and tear, minor wear and tear in the joints of the spine that has flared up and led to secondary muscular pain. So in this scenario, I recently wrote a guide to managing your back pain, which you can download from our website, 5 Steps to a Better Back section. And there's some basic stretches and exercises you can do, such as cat-cow stretches, improving your pelvic tilt, which is a big factor in back pain, the alignment of the pelvis. Some of the osteopaths and physiotherapists I work with can do a basic assessment, as well as the chiropractors can do a basic assessment of your spinal alignment and pelvic tilt, and give you some exercises and stretches to help correct that, and other exercises and stretches you can do to help with that. Whilst there are plenty of resources online on exercises and stretches you can do, it's always better to have these tailored to your ability and your needs. A good assessment from one of our osteopaths or chiropractors or physiotherapists is helpful with that. They can also do some adjustments and figure out what kind of exercises are going to work best for you. That kind of multidisciplinary approach always works best. Before engaging in these exercises, just a short period of rest, just a few days with some simple painkillers is useful, just to let any inflammation in the area settle down. And always start off with very simple over-the-counter painkillers, paracetamol and ibuprofen, provided that you don't have any stomach ulcers or you're not prone to acid reflux, but always take the advice of your GP in regards to these medications. If the pain has persisted for longer than a few weeks, you've tried the measures just described with a chiropractor, physiotherapist, osteopath, and things are just not improving, so that's probably the time to start looking into things with some scans or some tests, further investigations. If you have pain radiating down the legs, that's a sign of trapped nerves in the spine, and there are some different causes for that. One cause for that is a slipped disc in the spine. I've recently done a YouTube video on sciatica. So usually when a disc slips, that gives you that acute onset of back pain because tissues get inflamed in the back. It pinches a nerve in the spine, and that can send pain shooting down the leg. Again, in most people, that usually settles down on its own and doesn't need any invasive therapy. But if you have any weakness in the legs as a result of that, that's an indication to be seen very urgently. Another common cause that I recently wrote a blog about and recorded a video about is lumbar canal stenosis or spinal stenosis. And this is narrowing of the spinal canal, this channel here that the nerves run through. And that's due to years of wear and tear, overgrowth of the ligaments, thickening of the ligaments, overgrowth of the joints and tissues that causes this narrowing of the canal. And the nerves just get trapped in that tight space. The classic symptoms are back pain from the wear and tear, but pain that goes down the legs that comes on when you walk usually settles down as you rest. There's a whole blog on that, on the treatment for that, but that's another indication to seek attention. From excessive wear and tear of the joints in the spine, you can start to get malalignment of the spine where one bone slips forward ever so slightly in relation to the other bone. We call that a spondylolisthesis. That can cause instability where the bones start to move abnormally and cause pain. And there are treatment options for that, which again include a physiotherapy and treatments like that I talked about, but sometimes that may need surgery. It's rare that surgery is required. Most of the time we can treat this with physiotherapy or injections just to cover the pain until the physiotherapy exercises start to take effect. When something more invasive is needed, we tend to do it nowadays with minimally invasive techniques using these special retractors and just using very small incisions in the back. So these are the common causes, and I've said most of the time they can be treated without anything invasive and usually settle down on their own. In extremely rare circumstances, we occasionally see other causes that are a little more serious and need a bit more urgent attention. Many patients have come to me worried about cancer spreading to their spine or things like that. It's rare if it's associated with weight loss, or you've had a recent cancer and you're experiencing back pain that's worse at night, or if you've had a weakness in the legs as a result, that's when you need some urgent attention. There are some infections that can also cause back pain, which just persists, pain that just persists, gets worse and worse and worse despite all the treatment. And again, this is why we say that if the pain has gone on for a few weeks, is not showing any sign of improvement, that's a reason to get a scan. That way you can rule out all of these things. But they are extremely rare. For the majority of patients, things settle down with simple, non-invasive measures. We have a one-stop clinic where we try and get to the root of the problem with a scan followed by a consultation. That's all included. The unique thing about our practice is that we work together with the osteopaths, physiotherapists, chiropractors under the supervision of a spine surgeon or the oversight of a spine surgeon, and our combined goal is to get to the root of your problem as quickly as possible, but also find the least invasive solution that gives you the longest lasting result. To find out more, visit my website or call us or email us, and hopefully we can help you.